body contour specialist at Drip IV Wellness in Newbern. And I wanted to hop on here today and go over some of the aspects of the body contouring service that we offer here and what that entails, and is it permanent or can it last repeatedly? Are the results permanent? How quickly do you see results? Body contouring is a non-invasive way to get rid of stubborn pockets of body fat. It also helps with skin tightening. So if you have been going to the gym and you've been dieting and you just got loose skin that you can't seem to tighten up in any way, shape, fashion, or form, the radio frequency here that we offer will help tighten that skin. Now, the body contouring machine that I have behind me does several different services, and we tailor each one of our appointments to our client. So the client comes in for a consult. All of our consults are free. We're going to go over your medical history. We'll go over the medications that you're on, what methods you're using, exercise-wise, like how much water intake are you having daily, because we need to have a lot of water intake when we do cavitation. I actually recommend that my clients drink anywhere from 80 to 100 ounces of water a day while they're doing this treatment. And yes, that sounds like a large quantity of fluid, but once you get into the habit of drinking that, it becomes second nature. You actually look forward to drinking that much fluid. Now, is body contouring something that is going to help you lose weight? It can help you lose weight over time, but it's not a weight loss procedure. It is to help contour those areas of your body where you've been having more difficulty. Like for women, our abdomen, hands down, abdomen and thighs. For men, they tend to have some buildup around their abdomen. They could have upper arms, thighs. When you come in, like I said, when you come in for your consult, we'll go over all that, and then we tailor that treatment to you. It could be that you don't need the actual ultrasonic cavitation portion of this. Maybe you just need the radio frequency. Now, explaining those two, ultrasound cavitation is using sound waves to agitate and break down your fat cells into a liquid form. And it's hard to grasp the concept of that because your fat cells are just up underneath that layer of skin. They're what's called superficial. And when we put the ultrasound waves and we apply pressure, it causes those fat cells to liquefy. Now, when fat cells liquefy, they release two things: free fatty acids and glycerol. Free fatty acids are picked up via your lymphatic system, they go through your liver, and your body gets rid of them. The glycerol, your body actually recycles, repurposes, and uses for energy. That's always a plus. Everybody needs a boost in it. Now, with the radio frequency, it's using radio frequency waves to help stimulate your body to produce more collagen and elastin in the area that we do. Target areas. Cavitation can be done on abdomen, flanks, love handles, rather. We can actually do cavitation on your back, but not over the bony aspect of your back. Women tend to have like that bulge up underneath the brow, and we can do it to your upper arms. We can do it to your thighs. We just want to try to avoid any of those baggy areas on your body. Now with radio frequency, there are 7 more places that we can do radio frequency with than we can do cavitation with. We can do radio frequency facials. We can do radio frequency to your neck. There's some women who come in who have the skin laxity of the neck. Radio frequency works amazingly well for it. We have vacuum therapy as well, and I think people get the mental image of vacuum therapy as something completely against what it actually is. We use vacuum therapy for breast lifts and butt lifts, and what that does is it helps pull fluid into that area so it can be utilized by the muscles in that area. So if you have sagging breasts, or if your butt's not as perky as it used to be, we can help with that as well. Now, there are some contraindications to this service. The main one for me is going to be if you have a pacemaker, any cardiac issues. We want to go over that in that consult so that we know we're not causing any harm anyway. we'll go, like I said, we'll go over your medication list and what your med history is. So normally we pick up on if there are any contraindications. If you're pregnant or breastfeeding, you cannot have this service done. Other ones that are more patient specific, so feel free to ask any questions. Again, like if you're on blood thinners, we don't want to cause any further issues there. You have the option to use vacuum therapy with your body contouring, depending on which machine the body contour specialist you go see. Hope it's me. I have a radio frequency vacuum, which helps drain that breakdown of those fat cells. It helps drain it towards your lymphatic system. Now, one of the other questions that clients have when they come in is how quickly they will see results. You can see results the first appointment. However, I'm not going to promise that you will see the results immediately. And the reason I say that is because I can take the fat cells and I can make them go away. But if you don't drink the fluids and eat a low calorie diet and exercise, then the work that I do is going to be for nothing because your body will replace that eventually because it's got to have storage for the free fatty acids and the glycerol that you put in your body. However, if you maintain that low calorie diet, you keep steady exercise, and you drink plenty of fluids, this can be a permanent situation. Another question is how much downtime will you have with this procedure? And the downtime for this is zero. I have clients that come in on their lunch break and they go right back to work. It's non-invasive, so there's no downtime. There's no surgical interventions in any way, fashion, or form on that. Exercise-wise, I do tend to go over it depending on my client and depending on their wants and needs. I prefer steady state cardio, especially directly right after the service. Because like I said, when we bust those fat cells, we release glycerol in your body. That is an energy source. So if you don't go ahead and use it, your body's going to store it back in the fat cells for use later. So right after you have a cavitation or radiofrequency service, we want you to do some type of exercise. And I tend to go with steady state cardio because one, you're not going to sweat to death. And two, because it's going to use up that free glycerol that your body has in it. Honestly, you would be surprised. Fluid is one of the biggest hindrances to this having supreme results. You have got to drink the water. That if you don't drink the water, you don't prime your lymphatic system, and there's no way that your body can pick up the free fatty acids to transport them to your liver and get them out of your body. And the easiest way for your body to get rid of things is to peel out. I offer other services as well. I know our Jacksonville office has a red light bed that is good for recuperation, muscle soreness. It does help your body make more cells. We also have the sauna detox blanket here as well. And you can see those tools right there. We also offer woodworking therapy at our offices as well. Woodworking therapy is actually going to help break down cellulite. Cellulite is misunderstood by pretty much everybody who has cellulite. It's not just that you have so much fat in that area. Cellulite is actually caused by the connective tissue that sits over top of the fat. It's pulled tightly. It's just genetically that way. It's not anything that you eat. It's not lack of exercise, too much exercise. It's literally a genetic thing where the connective tissues are pulled so tight that the few fat cells that do poke through it gives it that dimply appearance that you get with cellulite. Again, each appointment is tailored to what we go through in your body contour consult and what your goals are. I do have, and you can pull up our pages, we have clients who have phenomenal results. And they follow their diet, they follow the water intake and exercise to a T. And during the appointment, when you actually come in for an appointment, we take before and after pictures, and it's part of your medical record. But we also do that for the added bonus. You can see each appointment. Because sometimes it's hard as an individual to see the changes that you've made because you're so used to looking at you. Um, but yeah, we calculate your inches, we measure your body very well, we take before and after pictures. Everything is notated in chart worksheets. Are there any questions from anyone about any of the services? Like I said, this is my cavitation machine. Not all cavitation machines look exactly the same, but they function the same. They just use those ultrasound waves to agitate fat cells. And speaking of agitating the fat cells, I have had a client ask if it damaged any tissue up underneath it. It does not damage anything. What it does is it causes, if you think about your fat cells like a bunch of grapes, okay? The cavitation wand actually forces the fat cells to vibrate. Fat cells do not like vibration. They also don't like cold either. But it causes them to vibrate and it creates little air pockets in between them. And over applied usage, those little air pockets pop. Just that little pop causes that fat cell to liquefy because it can't stand the vibration. Now you can hear the cavitation wand, you can hear it all the way through your body. Um, but that does not mean that it's causing any damage because it's such a low frequency. Um, the radio frequency causes a gentle, like a warming sensation. It's a very warm sensation, which is great after you use the ultrasound line back there because if further questions that you need answered, you can look us up online. You can call into our office and we'll answer them there, or you can schedule a consult with us. That online is going to be www.dripivspy.com. Further, and let's do the whole new year, new you. Let's do it right this year.